Okay, so maybe I'll start off. I mean, this is, I termed this contemporary orgone therapy and somatic psychology, where worlds intersect, where worlds collide. I don't know. I felt creative at that moment. And now I have to go back to H.G. Wells and figure out where worlds collide. But the point that I was trying to get to in thinking about this talk is what are some of the similarities and differences between orgonomic treatment and somatic psychology, contemporary somatic psychotherapy. And I also thought that probably in the course of the day, many of these things would be flushed out and we could kind of expand upon them. So, and I think a number of them have. I mean, clearly what has been pointed out is that really the role of sexuality is really not that much present in many of the contemporary somatic therapies. And clearly the whole idea of the energetic functionalism that Reich speaks about, which we kind of talked about but not in depth, issues about pulsation, seeing things within an energetic phenomena is really not the way in which somatic therapists actually speak. And so that's some of the things that we touched upon. But what I'd like to do is talk a little more specifically about some of the thrust of what is happening in somatic therapies today and where that fits in terms of Reich. And it's interesting to talk to you as a group who know about Reich, because most of the time I talk to a group who doesn't know about Reich. And so I'm dealing almost like the reverse here. The reverse in terms of speaking about phenomena that maybe some people know and then say, well, here's where it came from Reich. And here, but here we have already where it comes from Reich, and that's been presented. But now it's like, how is it being manifested in the present? So why don't we just kind of just quickly go to where we just ended off, in the role of attachment. Okay? And as Harry was speaking about in terms of the attachment and where contemporary attachment theory has gone to, that attachment becomes a very central process in terms of body psychotherapies today. And where it plays a role is the whole idea of establishing and helping foster emotional regulation. And the regulation in terms of the regulation of one's emotional experience and how that occurs in a relationship and how that occurs between the parent and the child. And as a result of that, the child integrates that and is be able to emotionally regulate themselves. Now, of course, we know that Reich was into emotional regulation, but maybe in the sense that he didn't really put down the building blocks about that. How exactly does that become established? And in a lot of the contemporary psychosomatic therapies, there is more of a broader understanding and attempt and focus to, within the therapeutic relationship, engage in encounters that can help facilitate emotional regulation. So, what many somatic therapists begin to look at as they look about when something is happening in the interaction, they look at somatic processes which seem to indicate that the person is becoming dysregulated. Dysregulated in terms of how they're being able to think, how they're able to discuss things, what's happening in the somatic process, become very aware of their respiration, be very aware of their eye contact, and so on and so forth. And when they notice that there's dysregulation, they attempt to engage interpersonally in a way that promotes that regulation again. With the understanding, coming from attachment theory, that it is in that dyadic relationship by which regulation can be reestablished. In other words, we need others to support ourselves and to regulate. Okay? Without that base of others, we don't do that. And when we grow up in situations where we don't have it, we don't learn the skills to use others or even then know how to regulate ourselves. So, the emphasis then comes a lot upon regulatory behavior and helping people become aware of when they're becoming dysregulated, how to focus in on that, how to become aware of that, and then how to pull themselves back and use others and find a way of coming back. So when earlier there was a discussion about Reich saying go slow. You can blow a person out of the water or whatever. In other words, don't lead to too much energetic expansion that the organism can't really handle. From a contemporary somatic therapy, they wouldn't talk in terms of energy, but they would talk about go slow in terms of build processes that enable a person to be able to regulate themselves, with the understanding that without that, there is going to be a shutdown. Now, what does that shutdown occur, or how does it manifest itself? As Harry was saying in the end, there's been a very much of a focus upon what happens in the early years of life. And the relationship, what happens when the infant, when the individual is in the first contact with the environment, and how this facial, dynamic, dyadic kind of dance that goes on between parent and child again and again and again in a repetitive way builds these internal structures, which we mentioned Shore is talking about, that allow for emotional regulation. Yes?
I think it's really important to say that it's not just the facial synchrony and interaction, but it's the whole bodily synchrony. And,
okay.
And
they focused a lot on the face, but it's the whole body. Right. The face they focused on a lot because initially the infant is more focused upon the face, but it is this whole dance, this whole biophysical synchronicity. And it's through this synchronicity that the child learns to be able to gradually regulate himself. And by learns, what does that mean? Builds in structure. Okay? Builds in structure literally in terms of the development of structure. So, knowing from that and coming from that point, the somatic therapists who are trained in that way attune to that, continually attune to that and attempt to foster that. So that, I think, is a positive development. And I think when we think about Reich's work, or when I think about Reich's work, I think about it in terms of where Reich developed some of his ideas later on in the United States in terms of working with the face and the ocular segment. Okay? Now, Reich had an idea, which many of you know, in terms of the fact that we have segments of armor, which he called armor. Armor is essentially ways in which we contract, we hold, we bind anxiety, the ways we defend ourselves, the ways we kind of go like this and stay like this, armor being a chronic kind of contraction. And that these become organized in a functional way in terms of the face, the head. And he also had this idea that because you want to gradually promote the possibility of regulation, you help the person tolerate increased levels of excitation through developing or disarmoring from the head down. So, from the head down, you work with eyes, you work with the face, you work then with respiration, you integrate the body into the face, and so on and so forth. And essentially, the way he was talking about it, and he came upon that only later on in his work. I don't think if you really look at his early work, though, maybe that's not the case. We have to really talk about it. Maybe Philip, you would know about that. That his early work in Europe, whether or not he was so attuned to that, it became greater that he became more aware of the ocular segment especially when he had a child and Peter, and became aware of infant-mother interaction and the awareness of the child, that he began to talk and structuralize therapy in that way. And in a sense, the way I see it is that's another take, or this take in terms of promoting regulation, okay, through helping people become more aware of when they become dysregulated, through managing the interpersonal, which is the way that contemporary attachment theorists talk about the building of an attachment relationship, where the parent actually does that in an unconscious way. The therapist does that in a conscious way, and it's essentially beginning to work and undo the ocular and facial armor, though it's not really spoken about in that way. So, in that sense, what I'm saying in terms of where somatic psychotherapies are come from in that element, it's coming to a kind of understanding that Reich did, but through a different way. Bowlby, as much as maybe he knew about Reich or not, was not oriented in an energetic, functional way. But he was oriented in terms of what happens biologically, and the role for safety, and so on and so forth. And interestingly, that those people who follow that are coming to a similar kind of idea, though far, it seems to me, specific interpersonal way, that though Reich moved people in a more interpersonal way, he didn't really specify these specific interactions. So that's one way that somatic psychotherapy, kind of reversing, we're kind of in a sense often talking here about where somatic psychotherapy misses Reich, and where I would just want to throw in something is where contemporary somatic psychotherapy might add to, but needs maybe the formalization of an energetic phenomenon. Because literally, when we're facially talking, when we're engaging with another, it's all energy, right? It's all pulsation. It's all dealing with excitation. It's all dealing with a management of arousal. You know, when the infant plays and then we stop and we back off, what are we doing? We're managing pulsation. Okay? I play with you, I stop. Your eyes go this way, I let you regulate. You come back, I come back. All these phenomena are essentially bioenergetic phenomena. Tuning into that becomes a key role in therapy. And that helps the person regulate and helps the person deal with dysregulation. So, a key term, key takeaway here, if there is a takeaway, and around somatic psychology is the idea of regulation, dysregulation. And the whole understanding more about how the infant needs to develop over time the capacity for regulation. And without that, the kind of defenses that move in, which are more like the dissociative defenses, which are ocular defenses, in the eyes, in the face, and then of course in the breathing and stuff, which is so
in the whole body.
And in the whole body. You want to bring me back there to the whole body? Good.
The reason that I'm so adamant about this is that my experience of a lot of the somatic work is that there really is a split between the mind and the body, and it really is a mind-dominated one.
Right.
And to look at just the armoring in the face as the predominant area of interaction or non-interaction is losing.
That's true. I totally agree with that. And to say along that the armoring of the face and the face is part of the body, but not the whole body.
Exactly.
However, again, that we're really talking about not only a body phenomenon, we're talking about an organismic phenomenon. So that's one aspect of somatic psychology that I just want to talk about. Another thing that is interesting in contemporary somatic psychology, which differs from orgonomy, is how one uses respiration, okay, and the role of breathing. And I think this, again, comes to this whole emphasis on regulation and dysregulation. Breathing in orgonomy is used as a way to mobilize excitation, to bring excitation alive, also to free up the respiratory segments which allow for full emotional feeling and expression. Okay. It's a way of heightening. Now, there's an understanding, of course, in orgonomy that if something is too heightened, you dampen it. And you dampen it how? By quieting the respiration. So often what is worked on in orgonomy, in orgone therapy, is the blocks to respiration. Okay?
The what?
The blocks toward free respiration, namely the respiratory, the diaphragmatic segment, holding in the abdomen, primarily, often holding in the chest as a way, because the chest is a seat of very deep emotions, as well as part of what they call the chest segment, which is part of the arms, towards reaching, making contact, grabbing on the world, doing something creative, all those elements that require a heartfelt connection. In contemporary somatic work, because we're looking more, it seems, and this is my spin on it, which could be totally out to left field here, because there's a focus a lot on dysregulation, there's an attempt to use the respiration as a quieting influence. Okay? So you help a person breathe, but you help the person breathe in a way that allows them to come down rather than up. Rather than excite, you have them come down and often down into their body and slow things down. So there's a clear plus and minus in this. I mean, one, There's a becoming unaware, helping people become aware of contact with their respiration, the goal of respiration, how it is used in terms of heightened emotionality, and how a person can then come down from that, okay, which is important. On the other hand, it's a kind of teaching more of a controlled, slower awareness of respiration, which is not orgonomic. Orgonomic is attempting to kind of build the pulsation on both sides. Okay? And what's needed for that is the respiration should not only be broader, but not be controlled. Okay? So another aspect there where Reich's work in ergonomy is there's an attempt to not teach a person to breathe, but have breathing happen. In other words, when breathing is just an involuntary activity that supports an emotion as part of an energetic phenomenon. So if a person is scared, they're going to breathe in a certain way. And then if a person is happy, they're going to breathe in a certain way. And if a person is excited or if a person is sad, and that, if that's allowed to do, the emotion can move, the person can discharge the emotion, and you go through this cycle, okay, cycle. Many, many contemporary somatic psychotherapies, but not all, but some of the more recent ones around attachment and emotional regulation is less focused in on building that cycle. Which comes to the, given our time, the last thing I want to talk about is the question of awareness and mindfulness. Mindfulness is another key element in somatic psychology, and where it seems to be stemming from is now our integration and interested in Buddhism, in yoga, yogic philosophy, in the awareness of how important these elements are in terms of our own consciousness and our own health. And you know, I'm on one of the psychological listservs, and I can't have a day go by that I don't have a research article come past me on my computer saying, mindfulness is helpful for X, okay? For chronic pain, for anxiety disorders, you name it. Mindfulness is helpful for it. Mindfulness, and what is mindfulness? Mindfulness is a focused attention on yourself and often on your organism in the present. And it's a focused attention where there's a stillness, and you focus in on that stillness, and through that process of doing that, you become still. And in the stilling of that, you move from a more excited and maybe cortisol push, maybe stressful organismic state into a calmer state. And it allows your attention to calm. It allows you to be far more focused and engaged. The research is there that it is an enormously helpful process. And it fits in many ways with some of Reich's earliest ideas of helping a person become engaged through their eyes, engaged and aware of their phenomena. And that's what mindfulness does. However, there's a difference between the way Reich used mindfulness or awareness, and in fact, even the way Gestalt therapists who have been a wave of working from some of Reich's have used that, and mindfulness. The attempt in mindfulness is to almost have a distance. There is a stepping back. You begin to objectify, in some regard, your phenomena. It's not, and that's not to say it totally. I don't think it captures all of it, or maybe every practice. But it's an attempt to step back and objectify. And in doing so, as you're creating contact, you're also creating separation. Now, I heard the word interesting, and what's interesting to me about that, in a way, some of these phenomena can actually be seen as kind of ways that we can armor. You know, kind of armoring ways in which we slow ourselves, distance ourselves, and so on and so forth. And what I think is that if anything with armor, what is the whole idea of armor? Armor is not binding. Armor is binding that's chronic and can't be undone. So, if there are ways that we learn to slow down, to attend, and so on and so forth, that are helpful, go by and do it, please. But if it becomes a chronic way of being, that becomes not something that one does, but is done to them, whereas Reich would say, I have a smile in, you know, in some integrated, I have my armor or I armor, but the armor doesn't have me. Once that occurs, then it no longer becomes a way of self-regulating, which is all part of this thing that's in somatic psychology, but it's a way in which we are over-regulated. So again, it spins back to this whole issue of awareness, of regulation and over-regulation. Now, why possibly, in the sense of these discussions, does that occur? Is because the whole issue of pulsation, the whole issue of charge and discharge, the whole, quote, function of the orgasm is not looked at. And if it's not looked at, then you're going to have these different aspects that are seen and understood, but going back to what's been said, not understood within this whole. And that's where I think, and coming back to the beginning of it, we're kind of talking about somatic psychology, but talking about it from Reich's functional framework is going to provide a real important addition. And at the same time, really understanding the additions that contemporary somatic psychology have that can be put into orgonomic framework and can expand upon the repertoire that we as therapists, if you're a therapist, or we as people living in the world have in order to function better. Are we going to have a...
You know, what's referred to as somatic psychology these days is just about anything that sort of, you know, has something to do with the body and something to do with the mind. I mean, it's such a wide, generic field. It's hard to almost grasp it to comment on it. But I think it's essentially what you're saying is they're missing some of the points of Reich's, the idea of the pulsation and the social and energetic function. They seize on ideas of the autonomic balance by controlling the breathing. They're slowing down the stress response, so you get an autonomic balance at wherever you are in your armoring. But yeah, to the degree that you can maintain more less stressful response, stop the internal dialogue so much, and experience more, well, maybe you'll see where you are in the world. And as a therapist, the more that you can do that, the more you're going to contact you're going to have with the patient. I think ultimately, it's not so much the technique that you're using as a therapist, whether it's orgonomy or attachment theory. It's the ability of the therapist to establish the contact with the patient and enter into that energetic dance. And so the name you whack on it it becomes less important than your own growth, your own ability to experience and feel the person you're working with and feel where they're at and be able to push their boundaries a little bit. Just on the subject of the internal dialogue too, I think you can certainly quiet the internal dialogue by meditation and mindfulness and things like this, which your internal dialogue is constantly reinforcing your view of the world, your armored cognitive state. In my experience, what really helps with bringing the internal dialogue down and helping somebody quiet is getting the energy down, getting the energy out of the head into the body. As your energy is more in your body, you're not in your head so much, you don't have so much chatter going on, and certainly you become mindful, whether you want to or not.
It's like kicking the sleep.
Yes, I'd rather not be mindful very close.
I'm trying to think whether or not Reich, if he were still with us, would take a position on these kinds of concepts like mindfulness. I mean, I'm inclined to think that either be against it because it's too artificial and as you said, doesn't necessarily promote spontaneous emotional expression. But on the other hand, I don't think that he would have counseled people not to use it if it was helpful.
Basically, anecdotally, based on other things he said, he would probably say something to the effect of, does it establish, but Dr. Weichner, does it establish the orgasm reflex?
Well, he might say that, yeah.
And it's
he could
fine
very
if it
well
doesn't.
have said that, but I think that there's a deeper issue, if you will, which is that what made Reich so radical in his approach to therapy was that he respected the individual expression of emotion in the organism.
Yeah.
And so if you have a preconceived idea, well, it's good for us to be able to experience this kind of calmness and so forth and so on. I think that he would have said, no, we have to look at a person that we're trying to help and trying to think of what that person could be if his or her energy was free flowing. Unfortunately, the social environment is not always conducive. But I mean, I think that there are certain general principles that I think he would go along with. The idea of contact, and that's why I think he came to be so concerned about the ocular segment, because that was what puts you in touch with reality, and that's what makes you see clearly. And my understanding of that is that if you can free the ocular segment, in principle, you should automatically help somebody regulate, because that person is now in possession of a grasp of reality, of the world. And then the same thing for the other segments, you could probably say. So, I think that Reich was more radical than we can always be in our own practice. And he would want to establish as much as possible the free pulsation of energy without preconceptions.
That was his explicit criticism of yoga and function of the orgasm, right? That managing breathing was
I didn't want to mention that because I'm not sure he knew much about yoga. But he did say that.
But sometimes in using some of these therapies that can calm you down enough that you can actually get in touch. That's what happened to me. That really gets you in touch with where Reichian therapy can really help.
Yes.
You're so diffused and you don't know where you are and you're hysterical. It's not just about being calm. It's just about stopping long enough for a moment to find out, oh, I'm not seeing, I'm not breathing, even if I'm trying. And it can be very helpful.
Yes, exactly. Well said, yes.
Well, in terms of these two, what appear to be diametrically opposed forms of breathing, really aren't.
They're really not.
In my own experience in therapy, the beginning of my sessions with my orgone therapist, who shall remain nameless to protect him from the beginning of my sessions, there is that energetic breathing, the excitation breathing, and then following various things, the discharge, etc. The breathing towards the end of the session is a very different kind of breathing, and it's much more like calming breathing. But I want to say something about this mindfulness and this calmness business. It seems to me that for Reich, his notion of what a, quote, healthy person would be like is one who's not only in touch with those moments of calmness, but one who can easily give vent to rage in the face of certain kinds of provocations, who can feel fear, because there is such a thing as rational fear. And so, it wasn't so much of the kind of influence that comes out of yoga and the Eastern philosophies is being very calm and being very centered, which seems to look upon anger or sadness or fear as somehow negative or to be avoided. And I think that's very, very different from Reich's perspective.
Yeah.
No,
It is worth noting this one thing about the segmentation piece. I don't know how widely it's recognized in these other somatic psychology approaches, this notion of segments. Yoga does recognize it, but in a very, almost a reverse way from Reich. So there was like a genuine observation that then gets mystified, etc. But the notion of different levels or different areas of energy.
No, I think what you're saying is exactly true, and I had it on my outline but never got to it. The whole idea of the difference between the feeling and expression of emotion and where emotion and the intensity of emotion lay, and the way you're pointing it out is exactly pinpoints. And it's not across the board because, you know, as you were saying, there is such a broad range of somatic psychotherapies that it's hard. I'm just putting a spin on some of the more contemporary attachment viewed one, but you know, but what you're saying, right on the mark. Yes.
Most of what I've heard about regulation and self-regulation is in terms of infants and parenting in the Boston research community. And what concerns me about that is that the focus really is to get the child to quiet down. There's not an appreciation of the expression of feeling, of emotion. It's rather, how can you stop this kid from crying? How can you get them on a pattern for eating? You know, what's the way to control the child? Now, they might not use that language because they're going to use the language of regulation. But in fact, that's what it becomes. And what's always missing in the work with parents, in my experience, with parents of young children, especially from 0 to 6, is that there's any genital feeling or any genital development. And that's something that we haven't even discussed here today in terms of children, and how that's expressed, how it's felt, and how therapists deal with it, how parents deal with it. But it's part of that energy and the pulsation that's critical to helping the kid grow up sane and healthy.
That's right.
Yeah.
I just want to add my 2 cents. I'm a nurse practitioner student. I was a chocolate educator for years, and I do like women labor. And just in birth, in the labor process, this is very, very beautiful illustration of the balance between, you know, expression of emotion and regulation. Because it's very important for a laboring mother to be able to express herself, to breathe, to scream, yell, but yet keeping the expression as lower toned really helps the birth process. But also, you know, the expression of the emotion is very important for the body to respond to labor, the pulsations, which are, you know, beautifully, you know, seen in labor itself, in the contractions and the rest between them. If the woman can ride those waves, you know, responding to them, but not, there is a point where there's overreaction. I mean, there's the expression that she needs to allow the birth process, but when the expression becomes over-exaggerated, it really can hinder that process. So there's a balance and a dance that you're doing through the whole process as it builds, and it's, of course, culminating in the ultimate of organisms, really, the birth process itself, which is often described by women as, you know, we're very in tune with the process as an orgasmic release. Anyway, I just thought I would, because that when I got to know Hugh and he was teaching me about, like, you know, what little I've learned about origami and about pulsations and about the expression, we're always talking about this kind of this concept. It just struck me that I really had a sort of an intimate awareness of the segment of it, at least, of just by being aware of the birth process and the natural birth process when it's allowed to its fullest and not inhibited too much by drugs, etc., which is a whole other.
That's a whole other Exactly. Yeah.
I mean, I think a very, very good point is that in Reich's terms, orgasm is not simply, you know, an issue of genital, you know, or he used to call jam fucking. You know, it is operative in all sorts of interpersonal experiences and natural experiences, and one of them being childbirth. Dr. Reichian was one of the other group around Reich. Gave a perfect example of coming in. He wasn't an obstetrical specialist, but he was helping a patient who was in labor one of his patients with liver came in, and she was screaming and yelling, and she was totally off in the eye. She could not, focus, and the labor was not progressing. So what he did basically is he just really yelled at her and told him to look him in the eyes. And she got shocked and looked him in the eyes, and all of a sudden it all, and then the natural process began to take over, and the delivery became, it went from a problematic delivery to a fairly uncomplicated delivery, but it wouldn't have happened if he hadn't gotten her to basically get focused.
I had that experience. I was not covering the hospital a couple of weekends ago, and a florid manic patient came in, and the nurses were like, throw out drugs.
They get hysterical too.
So I just, got her in a quiet room and just kept the eye contact with her, and she calmed and she smoothed right out. She's still manic.
Yeah, my wife is a midwife, and she's been involved. She was a dance therapist, and she used this stuff immediately, and it's exactly the same as me. You have to bring it, just get it calm, and then let the natural, if you can.
Well, it's the difference between Lama's breathing, which is very controlled. At this stage of labor, you're going to be like this, and that, in some cases, can be helpful. It depends on the person. In other cases, it can be inhibiting because it's too structured and too rigid. So again, you're dealing with individual psyches and what they respond to inherently.
Okay, I think.
I was just going to say I practice hypnosis therapy as well, and I find too that and labor and delivery. If you prepare a woman with hypnosis, they can often, during labor and delivery, it helps them to navigate that process. Anyway, we're always talking about the relationship between hypnosis and this, which is something I've never heard explored, and it's very interesting to me.
We're going to have to get it cleaned up so that the workers can put the room back in shape. So thank you all.
Thank you.
Thank you. I want to thank David Childbirth and Phil Bennett for never again. Yes.
So what do we do with the research on respiratory sinus arrhythmia?
So, yes, and the way I'm going to penalize people who are earlier, I'm going to ask you to introduce yourselves.
So that's a longer discussion.